My name is Sheri Gon. I'm the instructor at the Johnny Burns School of Medicine, Department of Medical Technology. You may have had to visit your physician, and based on your physical exam, the physician may have ordered some blood tests, or perhaps a throat swab, or perhaps you had to pee in a cup. Have you ever wondered what happens to these samples? Well, it goes to the medical laboratory. And because the medical laboratory is a place filled with biological as well as chemical hazard, we do not normally invite non-laboratory visitors to the lab. So it's often not seen by the general public, but I will give you a sneak peek today. So these are the staff that works in a medical lab. They're laboratory assistants or phlebotomists. This is the entry-level laboratory professionals. Then there's the Associate of Science Medical Laboratory Technicians and the baccalaureate degree medical laboratory scientists. Medical lab directors can be pathologists or PhDs. So what do medical laboratory professionals do? These are the four elements of what we do: diagnose, monitor, treat, and prevent. So whenever you go with a chief complaint to your physician will do a physical examination and take medical history. But there's only so much that the physical exam and history can reveal. Let's say you have a sore throat. By looking at it, we can't tell if it's a viral or a bacterial infection. We would need a throat swab in order to test to see what it is. And based on the results, we can determine if it's something that will just need time to recover from, or if it's a bacterial infection, your physician can prescribe antibiotics. There are patients with chronic diseases that we can monitor, or if you're a cancer patient, you're probably on chemotherapy and we'll need to monitor your progress. So there are lab tests that we can look at to determine if you're improving or if there needs to be adjustment to your care. Transfusion services is the only practice area of the medical laboratory where we prescribe actual therapeutic medication called blood transfusions. Yes, blood is considered a biological drug. Although the nurses are the ones that administer the transfusion, it's the medical laboratory scientist that performs the cross matches and prepares the units for transfusion. The medical laboratory is also involved in preventing illness and disease. Did you know that all babies born in the United States and Canada are tested for metabolic diseases? So this is to identify which babies have inherited disorders. And a lot of these disorders, if they're caught early enough, we can prevent brain damage or other serious health consequences. So you may have probably heard of cardiac risk tests. So that's where you measure cholesterol, you fractionate it to determine high density lipoproteins versus low density. And we can assess your cardiac risk for heart disease based on your cholesterol and triglycerides. And then based on what your numbers say, you can improve your cardiac risk by increasing exercise or changing your diet and lifestyle. You might wonder, what are immune titers? So if you're vaccinated, will you know that you're immune to that vaccination or not. So we can test to see if you have the antibodies for mumps, measles, and rubella. And we can report that to your physician to let your physician know if you're immune or not. You might wonder, what is a good reason to become an MLS, or medical laboratory scientist? And here's some reasons. You learn an applied science. Yes, you learn biology, chemistry, immunology, but you're applying it in healthcare. So that's why it's called an applied science. You enter healthcare as a scientist. Although laboratory professionals do not provide direct patient care, we are providing information that can help in their health. So we are working more closely with the physicians and nurses, and maybe occasionally we'll interact with the patients. In this profession, you earn a livable wage. Now you can earn about $60,000 and up. You can acquire transferable skills. So all of the knowledge and skills that you learn as a medical laboratory scientist can be applied to other health professions, as well as some higher level investigative work in the laboratory. I know of a medical technology graduate who is now working in CDC as an epidemiologist. So he's using all of his skills and knowledge that he acquired as a med tech, and he's now using it to investigate infectious disease. So what's the academic preparation to become a medical laboratory scientist? There's the medical laboratory technician to medical laboratory scientist pathway. So you earn your Associate of Science as a medical laboratory technician from any of the accredited programs across the United States. We do have one here in Hawaii at Kapilani Community College. After you graduate with your ASMLT and you get your certification as an MLT, you can apply to the UH Manoa MedTech program. When accepted, you'll enter as a junior, and you will graduate in 2 years with your Bachelor's of Science in Medical Technology. After you graduate, you enter a post-baccalaureate training program where you're placed in a medical lab, and under the guidance of licensed, certified medical laboratory scientists, you will accumulate the experience necessary to qualify for the certification exam as an MLS. Another way to enter the medical technology program is to go the second degree route. So if you have a BA or BS in a science degree, this can be in biology, microbiology, biochemistry, molecular and cell biology, you can apply to the University of Hawaii Manoa MedTech program. And if you qualify, you can enter as a junior. So 2 years to complete the curriculum. You graduate with a second bachelor's, but this is in medical technology. You'll enter the post-baccalaureate clinical training, where you'll be under the supervision of certified and licensed medical laboratory scientists. And after accumulating enough experience in the clinical setting, you will qualify to take the certification exam for medical laboratory scientists. In the medical technology program, this is our core curriculum. Students learn hematology, or the study of blood cells, clinical chemistry, or the study of analytes within your blood, immunohematology, which is transfusion services, clinical microbiology, which is the study of pathogens, those bacteria that cause disease, and laboratory management. Because of the coronavirus pandemic, it's highlighted the medical laboratory. The definitive test for SARS coronavirus 2 is the real-time PCR test, and it requires highly skilled laboratory professionals with the MLS certification. So medical laboratory scientists are inquisitive because every day you're faced with analyzing different laboratory specimens and then providing information. Medical laboratory scientists enjoy science. They do it every day and they're good at it. Science is their superpower. Medical laboratory scientists are vital in healthcare. Did you know that over 70% of all medical decisions rely on laboratory information? And you can send me any questions at sgon@hawaii.edu. Sheri Gon. I'm a medical laboratory scientist and an educator in the University of Hawaii Medical Technology program. I was asked, why did you choose this career path? Well, I've always enjoyed science, and as a senior in high school, I applied and I was accepted into a summer internship program at the American Cancer Society. So at that summer internship, I met my first medical laboratory scientist who taught me how to perform immunological tests and how to raise a mouse colony, as well as to do tissue cultures. So fortunately, I learned all I could from that medical laboratory scientist about what medical laboratory scientists do. And I learned that there was a University of Hawaii Manoa program that you could just stay in Hawaii and become a medical laboratory scientist. The next question was, what do you enjoy about working in Hawaii? What can I say? Hawaii is a great place to live and work. We're an island state. We have a very diverse population. In fact, it's probably the most diverse in the United States. And so there's lots of different ethnic cultural practices and ethnic foods. So who doesn't like Korean barbecue? So it's an excellent reason why Hawaii is such a great place to live and work. The next question was, what are the best things you've learned through hardships in this job? Well, there's always the pressure in laboratory science to produce results quickly and efficiently. And so there's that pressure in the medical lab. But as an educator, my responsibility is to produce successful graduates who will go on to work in the community medical laboratories. So there's that pressure of making sure that all of my students are properly educated and trained. There's nothing more satisfying for an educator than to hear from their students about how well they're doing in their career and in their communities. So I see my graduates are working very, very well in whatever medical lab that they have found work in. And I take pride to know that I help produce their success. And so it would really satisfy and please me if graduates of the program would come and visit me. So here's an advice to all of you students. You know, when you are successful and you have your instructors to thank for that, please go and visit them. You'll really make their day.